This is part 2 of the endocrine system lecture. In part 1, you learned about the endocrine system in general and were provided with specific information about the adrenal glands and the pancreas. Part 2 focuses on the pituitary, pineal, thyroid and parathyroid, thymus, and reproductive system glands. The objectives for this unit were already presented in part 1. The pituitary gland, also known as the hypophysis or the master gland, is a small gland about 1 centimeter in diameter located at the base of the skull in a depression of the sphenoid bone known as the sella turcica. The pituitary gland is connected to the hypothalamus of the brain by a slender stalk called the infundibulum. The pituitary gland is known as the master gland because it produces or secretes a variety of hormones that are transported throughout the body and direct other glands to produce their hormones. The following is a list of the hormones produced in the pituitary gland, and I will provide a brief description of their functions. Prolactin is responsible for development of the breasts in the females and lactation after childbirth. Growth hormone, or GH, is responsible for generating the growth and development of bones and other tissues. Adrenocorticotropin, or ACTH, promotes the release of cortisol, another hormone which is produced by the adrenal glands. Thyroid stimulating hormone, TSH, promotes release of hormones from the thyroid gland and assists in regulation of the metabolic processes of the body. Antidiuretic hormone, or ADH, assists with the regulation of water absorption, preventing us from losing excessive amounts of water during urination. Luteinizing hormone, or LH, assists in the regulation or secretion of the hormone estrogen in females and testosterone in males. Follicle stimulating hormone, or FS, assists the reproductive organs, the testes and ovaries, in the production of sperm in males and ova in females. With pituitary disorders, the patient often has too much or too little of one of the hormones. Injuries can cause pituitary disorders, but the most common cause is a pituitary tumor. As we learned, the pituitary gland makes growth hormone, which stimulates the growth of bone and other tissues. Too little growth hormone results in dwarfism, and too much growth hormone can result in gigantism. Diabetes insipidus, also known as water diabetes, causes frequent urination. A person becomes extremely thirsty and drinks. Drinking results in frequent urination, and a cycle of drinking and urinating can prevent adequate sleep. The body produces large volumes of urine, which is almost all water. Diabetes insipidus is different from diabetes mellitus. Diabetes mellitus is related to the lack of production and/or the body's use of insulin. While the symptoms can be similar, diabetes insipidus is related to how the kidneys handle fluids in the body. Diabetes insipidus is less common than diabetes mellitus. Diagnostic tests on urine and blood can determine which type of diabetes is present. Usually, diabetes insipidus is caused by a problem with the pituitary gland or the kidneys. Diabetes insipidus is treated with medications according to the etiology. Pituitary tumors are fairly common. Statistics indicate that approximately 1 in 10,000 persons will develop a pituitary tumor. Pituitary tumors grow slowly, do not spread, and usually are not cancerous. Pituitary tumors are generally curable. Treatment is often surgery to remove the tumor. Other treatment options include medications, radiation, and radiosurgery. Physicians conduct a variety of clinical tests to diagnose pituitary disorders and diseases. A list of tests is shown on this slide. Now let's move to the pineal gland. The pineal gland, also called the pineal body or epiphysis cerebri, is a small cone-shaped structure that extends posteriorly from the third ventricle in the brain. The pineal gland consists of portions of neurons, neuroglial cells, and special secretory cells called pinealocytes. The pinealocytes synthesize the hormone melatonin and secrete it directly into the cerebrospinal fluid, which takes it to the bloodstream. Melatonin affects reproductive development and daily physiologic cycles. The thyroid is a very vascular organ that is located in the neck on either side of the trachea. It consists of two lobes just below the larynx or voice box. The two lobes are connected by a narrow band of tissue called the isthmus. The thyroid gland helps set the metabolism, the rate at which the body processes energy from food. The parathyroid glands are four small masses of epithelial tissue embedded in the connective tissue capsule on the posterior surface of the thyroid glands. The parathyroid glands secrete parathyroid hormone or parathormone. Parathyroid hormone is the most important regulator of blood calcium levels. When blood calcium is low, the hormone is secreted and released to increase those levels. Internally, the thyroid consists of follicles, which produce thyroxine and triiodothyronine. These two hormones contain iodine. About 95% of active thyroid hormone is thyroxine, and most of the remaining 5% is the triiodothyronine. Both of these require iodine for their synthesis. If there is an iodine deficiency, the thyroid cannot make sufficient hormone. This stimulates the anterior pituitary to secrete thyroid-stimulating hormone, which causes the thyroid gland to increase in size in an attempt to produce more hormones. But it cannot produce the hormone because it does not have the needed iodine. This type of thyroid enlargement is called a goiter. Millions of people in the U.S. have thyroid disease. Most of them are women. If thyroid disease is present, the body uses energy more slowly or more quickly than it should. There are four main types of thyroid disease: hyperthyroidism, hypothyroidism, benign tumors, and malignant tumors. The risk factors for thyroid cancer include being between the ages of 25 and 65, being female, being Asian, having a family member who has thyroid disease, or having radiation treatment to the head and neck. Symptoms include a lump or swelling in the neck. Tests can be ordered to see if cancer is present. Depending on the type of cancer and how far the cancer is spread, treatment might include surgery, radioactive iodine, hormone treatment, radiation therapy, or chemotherapy. Some patients receive a combination of treatments. Now let's look at the endocrine organs of the reproductive system. We'll start with the ovaries. Two groups of female sex hormones are produced in the ovaries: estrogen and progesterone. These hormones contribute to the development and function of the female reproductive organs and the development of the secondary sex characteristics. At the onset of puberty, estrogen promotes development of the breasts, distribution of fat evidenced in the hips, legs, and breasts, and maturation of the reproductive organs such as the uterus and vagina. Progesterone causes the uterine lining to thicken in preparation for surgery. In preparation for pregnancy. Together, progesterone and estrogen are responsible for the changes that occur to the uterus during the female reproductive cycle. This slide contains a list of female reproductive system disorders. Amenorrhea means that menstruation has not started by the age of 15. Premature ovarian failure means that the woman's ovaries stop producing hormones before the age of 40. Premenstrual syndrome refers to PMS, a group of symptoms that start 1 or 2 weeks before a female has her period. Dysfunctional uterine bleeding is abnormal bleeding that is not associated with a physical lesion such as a tumor, inflammation, or pregnancy. Ectopic pregnancy takes place outside of the uterus in the fallopian tube or the peritoneal cavity. Ectopic pregnancies require surgery to remove the pregnancy and save the mother's life. Polycystic ovary syndrome is a disorder marked by amenorrhea. It usually begins with an elevated level of luteinizing hormone, which results in an abnormal cycle of gonadotropin released by the pituitary. It is also referred to as polycystic ovary disease. Treatment includes weight loss, medications. Uterine fibroids are the most common non-cancerous tumors in women of childbearing ages. Treatment can include medications for pain relief, but in some cases, surgical removal of the fibroids may be indicated. The testes function as an endocrine gland. The testes are where the male sex hormones are produced. These hormones are referred to as androgens. Testosterone is the main hormone secreted by the testes. The testes begin to secrete testosterone during fetal development. At puberty, testosterone is responsible for growth and development of the male reproductive structures, increased skeletal and muscle growth, enlargement of the larynx, and growth and distribution of body hair, and increased male sexual drive. Anorchia is absence of both testes at birth. Hypogonadotropic hypogonadism is the absence or decreased function in the male testes. Riefenstein syndrome is one of a group of diseases in which the body is unable to respond appropriately to the male sex hormones, which include testosterone. Symptoms include abnormal genitals, breast development in the male, and infertility. Treatment with testosterone improves the chance that the patient will have a normal and healthy lifespan with the potential to have children. The thymus is a small organ in the upper chest under the sternum. Before birth and during childhood, the thymus helps make a special type of white cell which protects the body from infection. The thymus produces thymosin, a hormone that plays an important role in the development of the body's immune system. Cancer of the thymus is rare. The most common treatment is surgery to remove the tumor. Other options include radiation and hormone therapy. Here are some key word parts for the endocrine system, along with their meaning. In the third column, you can see some of the medical terms that we can create by combining word parts. You should return to the online medical dictionary to hear the pronunciation and become familiar with the meaning of the created terms. In summary, we have discussed medical terms related to the endocrine system and described common diseases and conditions and an overview of various treatments related to the endocrine system.